All right.
Okay.
There's your parasite.
And then last but not least, this just simply confirms what we saw on the first page. The fact that Blastocystis hominis, as I mentioned before, is a protozoan parasite. Protozoan meaning it's microscopic. This is not a worm. So don't freak out to that point. But nonetheless, you'll see here that it says many. That means that there's a pretty significant overgrowth going on here. The range is few to moderate to many. So there's a pretty significant infection. Again, just like I said with the yeast, this represents a root cause. So this is something that we would want to go in and actively work to eliminate and then restore the gut microbiome so that you have optimal long-term functioning.
And it'll even break down some of the other parasites that we commonly see right down here, and they were negative for all of those.
Yep, that's great.
Okay. Just talks about the consistency, the look of this stool.
Self-reported.
And
then lastly here,
which is amazing.
This is awesome that this lab does this.
Yep.
So basically, while they have these microbes in a petri dish, they test both pharmaceutical and natural agents against it to see what works to kill it. So that way we're not guessing. We're not just pulling at straws thinking, I hope this antifungal works, I hope this herb works. We know which ones to use in order to be effective in the shortest amount of time.
Which, look at this one, resistant. Yeah.
And this person, I mean, fluconazole is the go-to antifungal, and it wouldn't have worked.
Right.
So if working with a doctor, which oftentimes we'll network with doctors, we'll collaborate and say, hey, this person's experiencing this, they have this overgrowth, these antibiotics, these antifungals work, they don't. Can you please help us with this client?
It's really good to know this information so you're not taking pharmaceuticals if you don't need to.
Exactly. Yeah.
Okay. Check this.
Last but not least, same thing we have here. This is against the
Yeast.
Candida albicans. The previous was against the Candida krusei. Here we see the Candida albicans is sensitive to the traditional antifungals. So that can be an effective way. We here are all about getting in and getting out. So getting in with the quickest, most effective method that will also allow us to restore optimal health faster. So it's not a quick fix. We're trying to be as effective as possible. And the way that we do that is by combining what might be a pharmaceutical, if we have a doctor that will help us, or a natural agent. Do that while supporting the underlying factors that allowed this issue to arise in the first place, and then restoring your gut microbiome, restoring the immune system so that your body can do what it's supposed to do.
And you feel so much better.
So much better.
We've all experienced this.
Oh,
and
man.
the gut really is the epicenter of your health.
Yes.
It's amazing. The energy, the clarity, the skin, the puffiness, the bloating.
It's huge. So if you are struggling, again, with irritable bowel syndrome, constipation, diarrhea, gas, bloating, that and or fatigue, weight issues, skin issues, brain fog, sleep problems, like I said, together, not always together. This is one of the tests that we can run to identify what your root factors are in order to implement a personalized plan.